Assalamu alaikum and welcome to all on this video. In this video we are going to show how can we do laparoscopic suturing in a simplified way. For suturing, first of all we have to hold the needle with a needle holder. To hold the needle, at first we hold the needle at position A. That means it's a junction of needle and suture about 2 centimeter within the needle hub. After all, we will hold the needle at the position B. It is distal 1/3 and proximal 1/3 junction. And finally, we will hold the needle at the junction of distal 1/3 and proximal 2/3. Is a position C. You see, we are showing that we hold first of all at the position A, then position B. Now we are holding the needle at position C. This is the final position. And during holding this position, we can position the needle with the needle holder about 90-degree angle, and so that the needle holder and needle will become at 90-degree. And after that, the needle holder should be placed about at parallel with the incision line, and so it will make the needle perpendicular with the incision, and needle should pass perpendicularly through the tissue with the movement of our forearm supination and pronation movement. So after that, we will just use the curve of the needle and pass the needle through the tissue. And after passing the needle, before giving the knot, we have to keep in mind 8 steps of knotting. The first step is pre-positioning. That means making a long tail and a short tail by the suture. The short tail will remain on our right side as the needle is passed on from right to left. And after that, we will make a short tail about 2 to 3 centimeter length, and the long tail length will be about 2 to 3 times more than the short tail. If it is more larger, the wrap will become fall. And after making the long tail, I will hold the long tail with my right hand, as the short tail is on my right side. And immediately by doing that, the long tail, the C loop is formed. And after that, a suture and the needle holder angle will make an acute angle. And without making acute angle, the wrapping will be difficult. And both the tip of the forceps will keep on over the stitch. And after keeping that over the stitch, we will wrap, double wrap, and during wrapping we will touch the forceps with each others. And then we will hold the short tail with our left hand, and now pull the short tail, not the long tail. Now we will pull the short tail through the wrap, and if we pull the long tail, it will snag with the instrument. And after complete pulling the short tail through the wrap, we will tighten our first knot. After tightening our first knot, we will pass the long tail on our left hand, as because the short tail is now on our left side. And immediately by passing the long tail on my left side, it will form a U loop, or it is called reverse C loop. And now again we will wrap on opposite direction with our right hand, and then again we will pull the short tail through the wrap, and we will complete our surgeon's knot. And then we will give a extra securing knot by our right hand, and again it is as our first knot, but in this time we will wrap only single time. So, and again we will pull the short tail through the wrap. It is keep in mind that don't pull the long tail during knotting. And now it is important to do practice of wrapping, and otherwise the wrapping practice, if you don't do the practice of wrapping, it will fall repeatedly. So it is important do the practice regularly, and you know that even the best cricket player or football player may need to do net practice. So a surgeon regularly need practice to. I will do wrapping practice with my left hand. So it is very important to do the practice, and thank you very much. Thank you for watching.